to go. Okay, guys, we should be getting ready here to be on a live. I'm super excited to be back doing lives. It has been a little while since our last event. My name is Karen Hyde. I'm so excited for what we're starting today. So if you're watching this, you're about to learn a lot about cash leaks. How can we improve this in your business? There's going to be much more that you're going to be able to get out of Kevin Milligan that's with me today. But I wanted to share that this is a conversation that it's part of something much bigger than just this live interview. So if you're watching this, stay with us. What we're really wanting to accomplish here, it's our mission behind Skill with Stability. Skill with Stability is a movement JC and I have started, along with many others that are part of our team, that believe that businesses want to grow the right way, not at the expense of their marriage, not at the expense of their faith, and definitely not at the expense of their health or their family. Our event is all about building businesses that are not just bigger, but stronger, that create freedom, that serve people well. And more importantly, I think that transform communities. And today I want to spotlight one of our amazing speakers. So Kevin, you're the first one with me. Like, this is the first session. So that's cool to be the first. Your topic hits a pressure point that I feel almost every business owner feels, but very few actually understand, which is healthcare, right? And so I'm honored to have you here. Kevin, just for you guys, if you haven't heard about Kevin Milligan before, Kevin is a seasoned leader with over 30 years of experience spanning healthcare executive leadership and public service. You've spent over, I think, nearly 2 decades as a healthcare executive, driving operational excellence. And today he's serving as the vice president for healthcare services inside of Branches, which we're going to learn a lot more. Kevin, I'm truly honored to have you here and ready to get started. Are you ready?
Yeah, thank you so much for having me, Karen. It's just a privilege to be asked to speak with this group. I love the work that you're doing, love the community that you're built, the community we're serving here at Branches also. So looking forward to sharing some of my trials and tribulations in healthcare and hopefully be some help to some of our members of the community.
I cannot wait. And by the way, guys, Kevin's actually going to be leading one of our tracks. So part of the goal with this sessions, if you're watching this, is for you to be able to understand more of what you're going to be able to get at Skill with Stability inside this track. And so if this topic is something that I really need to learn, or I really need to send somebody from my team to learn, make sure that you pay attention and that you pick this track for the session. Let's get started talking about healthcare. Why do you believe healthcare is one of the biggest silent cash leaks in most of businesses today?
Yeah, thanks, Karen. Great question. As you mentioned earlier, I spent 20 plus years in healthcare, and I've worked in small community critical access hospitals, and I worked for one of the largest healthcare systems in the country and in the world. And during that process, working with my partner in business development, as we worked with community businesses and members, we were actually seeing the impact healthcare has on their business from an expense standpoint, from a satisfaction standpoint. When you talk to HR departments, it's one of the number one things and questions they field. And when you look at the expense line item on your P&Ls, your profit and loss, it's usually the second largest item right behind wages, and it's growing year after year. And we grew up in a small community area, and we're very proud of our locally owned community businesses. And as we got into healthcare, we recognized our ability to keep independent businesses independent and in the community and serving our community. We had to find a better way to provide a better healthcare option solution that's better for their employees, better for the employee's family, but affordable for the business owners. And so during our process of serving our communities and building healthcare delivery models, we recognized that the current state of healthcare delivery is just not sustainable. It's not affordable. It's a growing cost year over year for business owners. And business owners, when we meet with them, feel like they have no control. It's their second largest item on their expense line, but they have really no say or control over that product. So our goal was to design a delivery system that puts the patient back at the top and the business owner who's purchasing that healthcare for their employees back at the center, and give them some control over that cost item. And healthcare is such a confusing service line. The complexity of navigating healthcare is very difficult. And we recognize putting somebody, as we call them, the quarterback, with the employer that can quarterback and help guide them through the very complex navigation of the healthcare system is key to getting control of their costs and making sure their employees and their families are getting a high, healthcare delivery model. And so nobody's really taken on healthcare. If you look at the revolution of IT and other industries, healthcare has always been one that's been left alone. And it's because it's so complex and confusing and so big. So we truly believe here at Branches that there's two people that can reform healthcare, and that's the patients that are utilizing healthcare and the business owners who are actually purchasing the healthcare. So we look forward to working with employers to kind of start that revolution.
Well, I love that you guys have taken on the challenge, because it is daunting. It is hard. And when you don't have, a point where you can like refer to, you end up making decisions that are not the brightest, right? They're not the best decisions. So I'm glad that you're making this effort to change this. I'm curious about your thoughts here. And let's just think about the example. If a business owner is doing, let's say, 1 million to 5 million a year, how much money would you say are they unknowingly wasting on healthcare?
Yeah, great question. So one of the ironic parts of our story is the co-founder and myself of our direct primary care program. We're both working in a health system, and we actually started with ourselves as the healthcare provider. I was working for a large health system, 1,100 employees hospital, and we were having trouble controlling our healthcare costs. Kind of ironic, right? We're in healthcare, and we are struggling with managing our healthcare costs. And so when we were able to implement this on ourselves as kind of a pilot project, we've seen a 3-to-1 return on the dollar that we spent. So 18 to 24% is what you can expect to save over an annual basis. And we were blessed to actually see that in the first 3 years in varying forms. And the other employers we've worked with have had the very same experience. And now, as you see the growing trend of direct primary care across the country, 10 years ago, there was maybe a couple hundred clinics. Now there's over 7,200 in the country and growing. And when you look at their case studies and their performance, the 18 to 24% is what you're starting to see on a return on investment, just on a basic enhanced primary care.
I mean, that's crazy. Can you imagine like a company at that size, right? 1 million to 5 million is what we're talking about. Being able to invest that back, whether it's like in their teams and better, structures for their clients and their companies. I think that's just amazing.
It's a great opportunity.
Yeah, it's an insane opportunity for them to be able to do more, and especially companies that are really wanting to improve the lifestyle of their employees. Really invest back. I think it's such an opportunity. I want to go back into your experience, because 30 years in the public service, healthcare leadership. I mean, you have done a little bit of everything that involves business owners today. Yeah. And what a better person to help us with this challenge. What led you originally to this work? I want to go back into that a little bit.
Yeah, that's great. Thanks. For the first 10 years of my career, I was in public service and working in law enforcement and public safety. And I was drawn to healthcare through some colleagues of mine who were physicians, starting a physician group. And, often, as it happens in a lot of our careers, somebody's seen something in me that I didn't. And they offered me an opportunity to come over to the healthcare side. And I actually began doing clinical research. We started a company doing clinical research for the FDA and the pharmaceutical industry. And so that's where I started into my healthcare endeavors. And then that led to managing large physician groups. And then ultimately becoming a chief operating officer at 2 different hospitals, one which was a 25-bed critical access hospital in a small community, and then the second role in a large healthcare system here in the U.S. Served as director of physician services, and then left there as the interim chief operating officer. So just had a great experience of getting to see healthcare from A to Z and understanding how it works from the business side of it, the pricing of it, the structure of it, the inefficiency of it, where dollars are really being wasted, and ultimately that being passed along to the employers and the patients. And so, God blessed us with the experience to go through this and understand it, so we could provide this type of information to business owners of where opportunities lie to reduce waste fraud, abuse, and also reduce their cost. And I appreciate you talking about as a redemptive value. You know, we here at Branches, that's what we do as our organization. We try to work with business owners to create redemptive impact, redemptive business, redemptive leadership. And when we recognize working with businesses being such a large cost item on their P&L, an area to, one, save dollars to help them scale their business and grow it, because we need capital to do that. But two, creating a margin to where they can begin to give back to their employees and their community. And you had mentioned earlier, talking about case studies, you know, we've had employers who've saved millions and millions of dollars that have used that to create scholarship funds for their employees. They've built parks in their communities for their community. They have helped reduce crime in their community. And so they're taking these dollars that they're actually able to, you know, save on their healthcare cost, invested in their company and invested in their employees. And that's why we love working in this community. They're business entrepreneur owners that are looking to have redemptive values within their company, and to be able to work with them on their second largest cost and create that significant cost savings, we really believe gives you the opportunity and margin to not only grow your business, but to really use it as a redemptive tool.
Love it. Let's talk a little bit more about Branches, because when I remember reading your experience, and then I was curious, is Branches just focused on healthcare? Do you guys have other programs for business owners? Talk to me more about what you guys do as a mission for Branches.
Yeah, great. Branches is a kind of a multi-pronged company. Branches is our parent company, but we have Branches Worldwide. It's our nonprofit arm where we select 10 business leaders and entrepreneurs across the globe every year. And we enroll them into a 3-year leadership development program, which we provide mentorship, monthly training and education. They have access to Branches Consulting, which is our for-profit arm of our company that does strategic planning, leadership development, obviously moving into healthcare also. And so every year we select 10 leaders into that program. They're enrolled. We help them scale and grow their businesses in the country where they're at, and then help them achieve their redemptive business models within their communities. And at the end of that 3 years, our leaders who graduate and become fellows, we say 30, we have at any given time, we have 30 leaders in the program. It's a 3-year program, but we're with them for 30 years. So relationship with Branches is long-term. We always say it's for life. And when they graduate from the program, they have the opportunity to access our impact fund, which is a small business loan they can use to get capital to continue to scale and grow their business. And then they become fellows in our program and help mentor and help coach and help guide other faith-based business owners across the world. So for Branches Worldwide, I oversee the leader selection process. So we're currently recruiting now and looking across the globe for those 10 leaders and businesses. And then we have Branches Consulting, which, you know, to run a nonprofit, as you know, you can't always sustain yourself on fundraising. So we started Branches Consulting, which is a for-profit arm of Branches, where we do strategic planning for businesses, leadership development, mentoring and coaching operations. We were able to process map operations, do lean processes. And then our newest arm that's been for about a year now is our healthcare services, where we offer direct primary care services to self-funded employers. So we're kind of diverse from this aspect. Our mission is to scope and scale and grow faith-based businesses across the world and globe, and have branches across all of the globe.
Well, I'm excited about this partnership with you guys and having you guys at the event. I mean, honestly, you know, everybody that's coming, you know, we have that foundation and those values and an alignment. And so I'm really excited for what you're going to be able to bring to them, not only in the topic of healthcare, but obviously this connection with Branches. Now, talking about your session specifically, you can talk more about the title and the details of that. But I was curious because you used the term or this phrase, redeem what's broken, as like the initial part of your session. Can you talk more about why that phrase, redeem what's broken, and then talk a little bit about what the people that are picking your track are going to be able to get out of the session?
Yeah, thanks. You know, redeem what's broken is we're looking at our healthcare world as the benefits. The healthcare delivery system in our country, we view it as broken and not and unaffordable for our employers. And we listen to our employees and their experience in healthcare. So, you know, redeem what's broken is here's an opportunity to redeem something or restore something that brings great value, not only to the employer, but to their employees. And so in the session, we're going to talk about how complex the healthcare system is, simplify it for the business owners, give them actually 10 questions that they can take away and talk to their their health benefits consultant and assess whether direct primary care is a good fit for them, and how can it save their healthcare costs, but also improve employee satisfaction and retention. We all know what a challenge it is to keep employees this day in the market. So creating a workplace environment where you're really redeeming, your employees, restoring your employees, creating a great work environment, and being able to invest in them. It's such an important tool to have. Healthcare is very important to all families. And so we have seen great experience with retention of employees and satisfaction of employees just by having a better healthcare option for them. So we love to look at where businesses have the biggest opportunity. And we recognize, both my colleague and I have spent many years in healthcare, seen it from the business aspect of it, learned from the healthcare aspect of it, and now we're blending those two to create less confusion. Because when you talk to business owners about healthcare, they consult with their healthcare business partner, and you purchase a plan, you give the card to your employee, and they go and utilize it. And that's really where it ends for most business owners, right? They feel like, I have no control over this. It's like a runaway freight train, where actually they have a lot of power and they have a lot of control. And it's not trying to micromanage your employees' healthcare, but it's giving you control of the cost and actually being able to provide them better experience that they're getting currently in the industry.
Well, I'm really excited, guys. If you're a business owner and you're doing, what would be, actually, that's my next question, because I give you the example of like $1 million to $5 million. Where does a business need to be at in order to really take advantage of this session? Can it be anybody that's just getting started? How many teammates? Like, tell me more about that.
Yeah, great. That's a great question, Karen. So we've had a lot of experience of trying to figure out what's the right number of employees you have to like really see the return on investment 3-to-1 and to sustain a clinic. And what we benchmark off of is about 1,000 lives. And that's not 1,000 employees. That if you have 500 employees, then their families and spouses and their kids. But what's cool about it is we work with different size employers. We're currently working with a group of employers that by themselves maybe only have 200 to 300 employees, but they've created a consortium, and the consortium now has their clinic to where 4 businesses have their clinic that their employees to create the 1,000 lives. So there's a lot of flexibility and options. You just don't have to be an employer that has 1,000, covered lives on your plan. We work with a lot of employers that have up to 100, 50 to 100 employees, but we have a consortium of businesses that have now come together because they've seen the value of it and actually able to have a clinic that serves 4 businesses that are working in the consortium. So there's a lot of flexibility, a lot of different avenues we can go with that. But traditionally, to have a clinic, you're looking at about a total of 1,000. You can do it with less. The return on investment maybe looks a little different, but that's generally the number we work off of.
Well, and I think the cool thing about having this knowledge and preparing yourself is as you grow your business, like this, it's important. Even if you're not there today, it's important to have this knowledge, because you never know how you could be saving, money right now and reinvesting that into your business. So that's really cool. Let's talk about some success cases that you've had, Kevin. Obviously, in this 30 years of experience, but what does it look like when a business owner becomes a better steward of this expense?
We've had so many great stories that we could share, and not only ours, but colleagues of ours in the organization. Some may have heard or be familiar with the Rosen. Rosen is hospitality is kind of the godfather, we'll say, of direct primary care. They started many years ago, and they're one of the examples I use where they do scholarship funds and build parks and communities. But with our local employers that we work with, and what we were able to do with our clinic in the healthcare, is to take portions of those dollars and reinvest them back into our employees. What is it that they need from a work-life balance standpoint? I love the concept. We want to be successful, but not give up our lives. I can tell you, as a chief operating officer of a hospital, it was 24/7, 365. And when I had the opportunity to pull away, I recognized how I could be a better dad, a better husband, and didn't have to be controlled by the business. So I love the concepts of when we can take these dollars and then invest into our employees that create a better work-life balance for them and their family. I think it's such a great success. We're working with employers now that uses these dollars to scholarship funds, for their children, working with them and their local foundations of their choice of donating dollars to make impacts in their communities. And seeing employers with a redemptive mindset take those dollars and invest them back into their people, the retention rate of employees goes through the roof. We're working with an employer now, has about 2,500 employees. And as we work with other businesses locally on the leadership development side, one of the first things they ask us is, hey, what is this employer doing over here? Everybody's going to work for them. And it's amazing to watch this happen, but it's because they're redemptive values that they're investing in their people. They're putting their people forward, and that's how they're using their dollars. So we've seen them invest in scholarship funds. We've seen them invest in charitable events in their employees' communities, give back in so many different ways, and then provide additional just benefits to their employees because they can afford to do that. One particular employer is using a portion of their savings, and they create mentor and coaching sessions for their leaders for free, unlimited access to career development. So things like that make a big difference in a lot of people's lives.
It really does. If somebody's listening today and they're feeling overwhelmed by this topic of healthcare and they're a business owner, obviously, what encouragement or advice will you give them today, Kevin?
Yeah. And that's a lot of people that's probably listening today, and a lot of people that are going to be at the conference. We've been there. What I can encourage you is there's hope. You have a lot of buying power. When you think about who truly purchases healthcare in the United States, it's the business owners. They pay for the healthcare plans, and ultimately the cost of the healthcare trickles down to who? The patients and the business owners. And so there's a reform growing in this country, enhanced primary care, direct primary care, where we're really looking to put power back into the hand of the business owners. They're bearing the expense of it. The patients are bearing the expense of it. So there's hope. Number one, it's arming you with the right questions to ask. Should I be self-funded versus fully funded? And how does maybe my benefits manager encourage me to be fully funded? Because often what they tell smaller businesses, well, you're too small. Well, really, that's not the whole truth. If you don't have a control mechanism and go self-funded, it could be high risk. But now that direct primary care is in place and you can have a control mechanism, you can go self-funded. You can save on those annual 18 to 40% increases in your renewals. We're working with companies right now this year that have seen anywhere from 20 to 40% increase in their annual premiums and being fully funded. So we're going to arm you with the questions to ask. There's avenues absolutely out there for you. And as business owners, you have purchasing power. And as we bring this community together, it's only going to strengthen us and help reform the healthcare delivery system.
Well, you guys heard it. Thank you so much, Kevin, for sharing this. This is definitely going to be a valuable session for anybody that's wanting to build a business, that's wanting to give back to their community and specifically to their team, right? I think that's the beauty of how do we, in business, how do we save money here and how do we reinvest it, in the best way? So the outcome and the outputs that we're getting from this investment, that ROI, right? It's
Absolutely.
It just continues to grow. Thank you so much for the time. I'm really looking forward to your session. For anybody that's still, I don't know why, waiting on getting your tickets, the link is down there, scalestability.com. Go and get your ticket. I think we have only 15 VIP tickets left. So that's huge. And I think we're sold out of mezzanine, if I'm not mistaken. So make sure to get your tickets. Make sure to book this session for your track. And I cannot wait to see everybody there. Thank you, Kevin, for this time. And I'm looking forward to meeting you in person very soon. I mean, we're how many days? Like 80 days away or something like that.
Won't be long. Thank you, Karen. I look forward to meeting your community.
Absolutely. Thank you, guys. Have a great day. Thank you all.